Hi, my name is Beatrice. I'm 47 years old, born and raised in Miami, currently live in Delray. I came to Dr. Lampert for a explant and breast lift, and I'm currently 2 weeks post-op. Originally, I was coming to Dr. Lampert for a breast implant exchange. But as of 6 months ago, I decided to go in the avenue of having them removed altogether. I started experiencing some breast pain. I also started noticing that I was having limitations as far as exercise. In order for me to run, I would have to put two sports bras to keep my chest nice and tight in order for me to be able to get on the treadmill and run for like 10 minutes. I felt excessive weight on my chest. You start noticing all these different symptoms that you didn't realize before. When the breast pain started, I started noticing all these other stuff that came into play that pretty much directed me into just having them removed altogether. I had my implants placed in 2006, so they were 17 years old. I was definitely already a candidate for an exchange. So I started to look into different surgeons to see which ones were going to be a better fit for me. But prior to that, my sister was a patient of Dr. Lampert, and she had her implants removed. And then my daughter, who's also a patient of Dr. Lampert, she was suffering from breast ptosis. So for me, it was a no-brainer. My sister trusted him. I trusted him with my daughter, so it was an easy choice for me to make when the time came that I was going to have them either replaced or removed. I knew Dr. Lampert was definitely the surgeon for me because I attended my daughter's consultations. I was there part of her surgery. I saw how everything was, so well organized, how at ease my mind was that I knew my daughter was in the best care with him. So it was pretty much a breeze for me when it was my turn to have the surgery to just come in and have my procedure done without a worry at all of my well-being, of the outcome, because every single question she had, and she came multiple times for consultations, and each time he welcomed her with open arms and went over and beyond to answer any of her concerns. The hardest part of my recovery was definitely the limitations. I'm very active. I decided to have this surgery at a time where it was pretty quiet during the holidays, through Christmas and New Year's, so it was perfect timing for me. The drains were a little scary, but once you were day 2 in it, you knew exactly where to position the drains and how they, so they didn't interfere with when you're bathing, not being able to cook or pick up anything from the floor or even a gallon of milk, but other than that, you have to do your part in order to have the best outcomes. So you just pretty much have to plan on resting. We're empty nesters, and my husband and I were big Harley Davidson motorcycle riders. We attend a lot of events. We do a lot of the Key West rides and Daytona rides, and even rode up to Sturgis. But as of late, I wasn't able to ride anymore because every time that there was a bump or a hollow area in the street, the impact on my chest was it was too much. So I started not even riding anymore. I am super anxious, super excited to be healed 100% and be back on the motorcycle with my husband doing the things that we enjoy. As before, it was just giving me a lot of limitations other than exercising and fun stuff that I was used to do that I couldn't do anymore. I feel that post-op, it's been 2 weeks, and as of probably 6-8 months, a year, I was experiencing a lot of anxiety. I didn't know what to attribute that to. I was already growing a fear of driving. I had to be driven to long distances to the doctor's appointments because I live in Delray. So to come over here, my husband always had to drive me. Today was a day that my husband wasn't able to drive me for my post-op. And he asked me, "Are you gonna be okay?" And I was like, "Oh, I'll manage." And honestly, I don't know if it's tied together. There's so many complaints about breast implant illness, and so many people have so many different symptoms. Anxiety was something that I had never experienced before, ever. And as I said, for about a year, I've been, limited in even driving long distances. And today I got in my car, I drove over here by myself, and I didn't even think about it twice. Another factor, I was tired all the time. Sure, you go your first week with anesthesia, you're recovering from all that, you take a lot of naps, but after that first week, the second week, it's like, I feel so energetic. Yes, I'm limited, I still have to follow his instructions as far as I can't lift anything heavy, I can't exercise, no yoga, which I love, no Pilates, no gym, just walking. But I do feel like a complete different person. My neck doesn't hurt anymore. I didn't have overly huge implants, but my back was bothering me, my neck was bothering me, and those were other things that I was encouraging myself to remove the implants and definitely not have them replaced. So this is my third breast surgery. So I've had multiple experiences in two different settings, whether it's in a hospital setting or in a ambulatory setting. When you're in a hospital setting, you have 5 different nurses. The first one comes in, puts the IV. The second one comes in, tells you, to put the gown on. The third one comes in. So it's always like different faces that you see. In the ambulatory setting, in Dr. Lampert's staff, prior to the surgery, everybody's introduced. The anesthesiologist comes in, he asks you all the questions, again, tells you pretty much step by step, asks you if you're nervous, he gives you a little something so you can start mellowing out, throughout the process of them reeling you into the operating room. The communication between the staff and my husband every step of the way, from when they started to their midway to they finish, was extraordinary. The same kind of attention I received when my daughter was in surgery. So that was just so comforting to have someone completely keep you up to date, step by step of everything that they're doing. You're not rushed out. They wait till you are 100%, that you're coherent. They wheel you out to the car. They don't have you walk by yourself versus like in a hospital that, like I said, I've had both experiences, and by far an ambulatory experience outnumbers it any day of the week. The attention is just, amazing. The Dr. Lampert staff, from the girls in the office, setting the appointments, making sure your post-op, your pre-ops coming in, it's just, he has the winning team, definitely the winning team, and everybody does their part to the absolute best. And you leave here with nothing but peace of mind, that you know that you're in good hands. I'm still very confident with my decision on the Explant. If I had to do it again, he would be definitely the surgeon that I would choose. I have recommended him to a few of my friends that have already considered removing their implants as well. I would 100% recommend Dr. Lampert. He's a healer. He is not someone that's going to be placing ads of, get these 2 procedures and get the third one free or 50% off. He deals with healing patients' needs, whether it's because of reconstruction surgery because of cancer, whether it's reconstruction surgery because you're having an explant removed, or if it's a case like my daughter that had breast ptosis. He is the man for your reconstruction needs, absolutely, hands down.